People ask me why hand fellowship. I feel now 8 years in practice doing hand and wrist, there is still an ever-growing need because of an ever-present pathologies and ever-present neglect. Okay, so there is scope, a lot of scope for hand and wrist work. 3 things that help me is whether you have a passion towards a specialty. If you develop a passion, you should have a great mentor. For me, during my training period in hand, I had a good mentors all throughout. They helped me get into a good position. So these are the 3 things where you look for in any sort of specialty fellowship that you go: a passion, mentors, and position. In hand particularly, I would recommend at least 2 years of training. Okay, it's such a vast variety. It's just a small part of the body, but there are tremendous pathologies, many pathologies, and you need at least 2 years of good training. All my mentors and seniors here would tell you that 2 years is nothing. You're 24 by the time you're an MBBS, 28 by the time you are a postgrad, and maybe 31 by the time you do a fellowship. So you're very young, so 2 years is a very small time. Try and start early. If you develop passion in hand, try and start early, as early as possible. Probably you end up doing a fellowship right out of your postgrad. The first thing that you should do is be a member of a local hand unit or a hand society or a national hand society. In India, the Indian Society for Surgery of the Hand, the ISSH, provides excellent platform, many fellowships that you can avail and start using them and start getting trained. It also provides you a lot of academic work on its website as well as one-on-one in person. Bipin would probably tell you more about it as he has been an executive member of the ISSH. For me, when I trained, that was the duration. So I spent about 2.5 years doing different fellowships. Where to do a hand fellowship? We have hand fellowships all over, starting in India as well as outside. Nationally, there is one program in CMC Vellore that has recently started MCH in hand surgery. It's a 3-year program that can be availed by anybody who has done postgrad in ortho or in plastics. And by the time you're done with 3 years of MCH, you will be a qualified surgeon. The second one is an FNB hand and microsurgery. This is offered by the DNB board. This is a 2-year program. This is an all over the world recognized program. And I think there are about 6 centers in India, including CMC Vellore, Delhi, Ganga Hospital, Manipal, Kerala. So you can find this on the DNB website. And it's a very structured program with an entrance exam and an exit exam. And I know my colleagues who have done this, and they are excellent hand surgeons by the time they have done FNB. The other options that you have is you could do a fellowship, which is an observer's position that you can do with any of the leading hand surgeons in India. We have few of them in Mumbai, we have a lot of them in India. The fourth option to do hand training in India would be a specialist registrar. That's what I did at Ganga Hospital for 1 year. It didn't give me a degree, but it gave me an excellent opportunity and opened my eyes to what the world of hand surgery offers. But you need at least a year in specialist registrar. When you go international, my exposure has been in the United States. I did an accredited fellowship. You need to do an ECFMG certification to get into an accredited program. However, there are non-accredited programs that you can apply, and you can contact me and I can share the details in depth with you. Make sure that when you apply to the United States, make sure whether there is an entrance exam or not, because you need to prepare way in advance for that. Also, the key is whether they offer you hands-on training. There's no point in spending 1 year looking at hand surgery. You need to be hands-on wherever you go all over the world. Briefly, the fellowship positions are available in Mumbai. We have mentors, Dr. Warrior, Dr. Tatte, and Dr. Patankar, who have small fellowship positions with them. Ganga Hospital, Coimbatore will offer you FNBs and specialist training programs. You have CMC Vellore, we have KMC Manipal, and Pune with Dr. Abhijit Vahegaonkar. For me, United States has been a great training ground, a lot of centers there. The other parts of the world, I would call on Dr. Bipin Ghanghurde. He has trained in the Southeast Asia as well as in the Europe. Bipin?
Thank you, Rohan, Chasnal, and Dr. Devnani. So I'd like to speak on the hand fellowships. So basically, I feel that I had been trained mostly in the eastern side of the world, but I still feel that Indian fellowships are the fellowships to go forward, because unless you stain your hand with blood, you are not going to go forward. Hand requires a long and a very long training curve. So you should develop a passion for this subject. How do you develop a passion? So my training in hand surgery came by default. I was in Wadia Hospital. So incidentally in Wadia Hospital, I was in pediatric orthopedic unit, but we used to work in plastic surgery unit as well. So in plastic surgery unit, there is Dr. Mukund Thatte, who, since there were no residents that time, orthopedic surgery residents were the only residents in plastic surgery. So we used to do burns as well as learn hand surgery with him and brachial plexus. So it is how it started. So I spent 6 months there. Sir told me to wait for 6 more months since there were no residents there. I waited for 6 months more. Then sir told me a very important thing. There are very few people in hand surgery. So would you like to take the opportunity to go to Ganga Hospital? At that age, around maybe 30, we are less likely to know or understand anything. Sir said that, so I told sir, okay, I'll go to Ganga Hospital, not a problem. So being in Ganga Hospital for 1 year has changed me completely. The person I was in Mumbai and the person I came out of Ganga was completely different, because there are 14 OTs when we were registrars there, around 7 orthopedic surgeons in hand fellows there during my time, and there were 4 DNB residents. So all of us worked together around the clock, and you know, it really increased your training and ability to operate. The most important part of this thing is that you need to have a plastic surgeon with you always, apart from an orthopedic surgeon, to do a hand surgery training. So you shouldn't have, we are not taught plastic surgery skills during our orthopedic training. So we need to have a plastic surgery training. Any which ways, you should get a post somewhere where you can have a plastic surgeon learn microsurgery in India from him for at least 3 months, know how a microscope works, because it starts with working of a microscope. You have never seen such a device before. I was amazed to see a microscope in Wadia Hospital when I went there first. So it is like a new world, beginning to a new world. So after that, you really have to go out and do your foreign fellowships. So foreign fellowships are just a pie on a cake, I feel. But try and get fellowships where you get hands-on. So I have been to places quite lucky enough to get hands-on. In US, as Rohan said, that you have to give the various exams to get on hands-on training. But if you go to the eastern side of the world, you don't need so many exams except TOEFL. So I was in Japan. So I was in Japan with Dr. Doi and Dr. Hattori. Dr. Doi is a very renowned brachial plexus surgeon. And Dr. Hattori was in wrist, trauma, microsurgery, arthroscopy. I spent around 1 year there. Language is a problem, but you do learn Japanese there eventually. Around 3 months, they observe you as anywhere else. And then after 3 months, they give you a post of a specialist registrar. So remember, whenever you go as a fellow outside, you are the senior most. Because you are well trained than them, you are much more capable than them. They select you only if you are capable. So you are capable, you should never forget this, that you are capable than the person who is standing, a local fellow who is with you. So always you can work in hand with them. Second hospital which I recommend is National University Hospital, Singapore, where I was not there, but I was as an observer there. But it's a nice place to be, and there is a lot of English-speaking staff, and most of the Singaporeans speak English, so you don't have a hard time there. Another place where people who are interested in microsurgery, most of the plastic surgeons go to this place, is a Chang'an Medical College in Taiwan. They don't offer a 1 year post position, but 3 months observer position they observe. For the wrist arthroscopy buffs, Hong Kong is a place to be. So Dr. P.C. Ho conducts a yearly wrist arthroscopy workshop and a lot of wrist training in his unit, but it has to be self-sponsored. So all these hospitals which I have told before, like Ogori, Daiichi and Singapore, they pay you very well. However, the remaining 2 hospitals, you have to sponsor yourself. And the very important thing, which I always feel that I missed, was that you have to work with your Mumbai seniors. You have to work with Dr. Patankar, Dr. Warrior. I still go and observe them, and their tips are practical tips which still help us during our practice in Mumbai, because our practice in Mumbai is very different than the practice abroad. We have to think many ways to approach a patient here. So after your 3 years of training in hand surgery, you can give this exam, which I was privileged to pass. This exam, it's a Europe, if you don't have a degree, if you have not done your FNB, 2 years of FNB. So if you have a degree, you will be recognized as a hand surgeon abroad as well. Yes, FNB is a very nice post to be position exam to get a degree. But if you have passed that age to give an FNB, after you complete your hand surgery training, you can give a European diploma in hand surgery, which can be given at any age. You just require your 3 years of hand surgery experience. The very important thing I feel for all residents and fellows is that we have to maintain our logbook, because logbook is what decides what you have worked. They see your logbooks, and based on your logbooks only and only they they allow you to give this exam. That is for the logbook. Second thing is, abroad, if you go anywhere, if you show your logbook, all the seniors will be impressed that you have been assisting so many surgeries and you have performed. Though we do so many surgeries, but we have no documentation. Every logbook should be signed by your senior or a lecturer anywhere in government college or wherever you are working. It should be signed on weekly basis that you have performed these many surgeries, you have assisted these many, and you have observed this many. So logbook is a key. I always maintained my logbook since my days in Wadia. So from Wadia till Ganga Hospital, not in my postgraduate times, but I think MUHS still has a logbook which can be maintained. So I think that logbook should be continued until your fellowships are over. And even now, I use and keep the documentation of the logbook. Thank you very much.